Data is everywhere, and in healthcare, it is crucial for making decisions about patient care. Imagine patients arriving in the emergency room in critical condition. Doctors and nurses rely on data to treat them. Some of this data is numerical, like blood pressure, heart rate, respiratory rate, age, weight, and lab test results, which measures biological parameters. Other data is categorical, like gender and the presence or absence of specific symptoms. Clinical decisions depend on this data. It helps monitor the patient's condition and determine their health outcomes. With more data, such as lab test results, doctors can make better decisions, leading to improved patient care and health-related outcomes. We work with data every day, although we don't always fully understand its concepts. Understanding data types is one of the first and most basic steps required for understanding research. Today's video topic is Data Types in Health Research. A comprehensive guide. This will be a short and comprehensive video in which we will discuss data types and scales of measurement in the context of research environment. Some aspects are difficult, and some overlap occurs between data types and measurement scales. However, I have kept things simple by citing examples and explaining the background. There will also be an exercise at the end, which you should not miss because it will help reinforce the concepts. Data can broadly be classified into two main types, quantitative and qualitative. Quantitative data is numeric in nature, presented in numbers. This type of data comes from either measurement or counting, such as height, weight, age, number of accidents per year. In contrast, qualitative data, also known as categorical data, is non-numeric data which describes qualities or characteristics. This type of data is expressed in natural language rather than numbers. Examples include gender, eye color, ethnicity, and presence or absence of specific clinical symptoms or findings, etc. Qualitative data is classified as either nominal or ordinal, depending on relationship between categories. Nominal data, like eye color and ethnicity, consists of discrete categories or values without any inherent order. In contrast, ordinal data have clear order or ranking between categories. For example, in describing pain intensity, low, medium, and high you can appreciate order between categories. Patient describing pain as low have less pain compared with medium or high pain. Quantitative data is further classified into discrete or continuous types based on how numbers originate. Discrete data, such as the number of children, consists of whole numbers that cannot be subdivided further. For example, 3 or 4 children are meaningful values, but fractions like 3.5 children are not. Discrete data is typically counted. Continuous data, on the other hand, is measured on a scale and can take an infinite number of values between any 2 points. This type of data includes fractions or decimals and can be subdivided into smaller units. Like weight in kilograms, decimals can be added to express smaller units like grams and milligrams. Examples in describing weight values like 3.5 kilograms or 3.546 kilograms are meaningful and indicate precision in measurement. There are 4 levels of measurement: nominal, ordinal, interval, and ratio scales. Moving from the lowest to the highest scale, nominal data represents the most basic level, while the ratio scale is the most sophisticated. Nominal data is distinct from all other types because it lacks a measurable quantity. Categories in nominal data have no inherent order or rank, which means arithmetic operations like addition, subtraction, multiplication, or division are meaningless. For example, blood groups O, A, B, AB are nominal categories with no natural order or rank, so even if numeric values are assigned to these categories, arithmetic operations on them remain meaningless. Ordinal data consists of categories that have an order, hierarchy, or rank. It falls between nominal data, which lacks order, and quantitative data. The key distinction is the interval between categories of an ordinal variable is not precise or is unknown. For example, In a 5-point Likert scale measuring satisfaction, ranging from very satisfied to very dissatisfied, the difference in satisfaction between each level is not consistently equal. Similarly, in an ordinal scale of skill levels like beginner, intermediate, and advanced, the skill gap between beginner and intermediate isn't necessarily the same as between beginner and advanced. Interval data is more sophisticated than ordinal data and is used for quantitative data, both continuous and discrete. It is measured on a scale with standardized and equal distances between any 2 points. However, unlike ratio data, interval data does not have a true zero, which would indicate the absence of the measured attribute. Examples include temperature on Celsius or Fahrenheit scales, where 0 does not signify a lack of the measured attribute but rather represents a point on the scale itself. Ratio data is indeed the most sophisticated among the 4 levels of measurement. It includes all elements of interval data. However, unlike interval data, the 0 in ratio data is true and meaningful. It indicates the absence of the measured attribute, allowing for meaningful arithmetic operations such as addition, subtraction, multiplication, and division. Examples of ratio data include measurements like length, weight, and car speed, and it is used for quantitative data, both continuous and discrete. This illustration, ladder pattern, outlines the 4 levels of measurement and one key word that best fits each data type, distinguishing it from the others. At the most basic level is nominal data, where there is no inherent order between categories. Moving up, ordinal data introduces an order between categories, although the intervals are not necessarily equal or precise. Interval data offers equal intervals between data points but lacks a true zero. Finally, ratio data is the most sophisticated, featuring equal intervals between data points and a meaningful true zero. Now, let's summarize and discuss the important aspects we haven't covered yet. We've already talked a lot about nominal data, so we won't go into detail on that again. Ordinal data is often used when we want to measure qualities or attributes that can't be directly quantified. For example, consider patient or client satisfaction. Instead of just knowing if they're satisfied or not, we want to know how much satisfied or dissatisfied they are, that is, to quantify satisfaction. Since there's no scale like weight or height for measuring satisfaction levels directly, we use ordered categories. These categories, like less satisfied, more satisfied, very satisfied, give us an idea of satisfaction levels, but this arrangement inherently lacks precision. Ordinal data is widely used in healthcare research. Imagine there are important health-related outcomes that cannot be directly measured through any instrument, such as pain, quality of life, fatigue, anxiety, depression, and burnout, etc. We use ordinal variables to create scales for these health outcomes. These scales, called psychometric scales, are used in all research designs, including observational and experimental studies. Additionally, a lot of research activity is focused on designing and validating these scales. The term discrete means individually separate and distinct. Imagine a lake with clear boundaries, separate from the land around it. Discrete data is counted and takes on a limited number of values. For example, in discrete data, points like 3 and 4 are discrete without any intermediate values between them. Nominal and ordinal data are also considered discrete because their categories are separate and distinct. However, in this presentation, we focused on discrete data specifically as it relates to quantitative data. A variable must be naturally discrete to be called discrete. For example, we usually record age in whole numbers, 23 years, 24 years, but age is itself a continuous variable. It can be divided into smaller and smaller parts, such as years, months, days, minutes, and so on. Continuous data. We already discussed continuous data. Focus on the word measured, because continuous data is measured. This data is often represented in decimals or fractions and can take an infinite number of values between any two given points. Interval data. Remember these keywords for interval data: quantitative data, measured ordered equal distance between data points, no true of absolute zero. Ratio scale. Ratio data shares all elements of the interval scale but includes a true 0 point, indicating the absence of the quantity being measured or serving as the origin point of the data. This exercise is designed to help you understand and apply the concepts of data types and levels of measurement. By correctly identifying these aspects, you will enhance your ability to analyze and interpret data accurately. How to do it? You are given a variable. You have to select its correct data type and level of measurement. Data type options: nominal, ordinal, discrete, continuous. Level of measurement options: nominal, ordinal, interval, ratio. Instructions. For each variable provided, determine whether it is nominal, ordinal, discrete, or continuous. Then, identify its level of measurement as nominal, ordinal, interval, or ratio. So the first variable in our exercise is body weight. You have 5 seconds to identify what data type it is and its level of measurement. Correct answer. Data type: continuous. Level of measurement: ratio. Explanation. Weight is a continuous variable because it can be divided into smaller and smaller units, allowing it to take an infinite number of values between any two given values. It is measured on a ratio scale because it has an absolute 0 point, meaning that 0 weight represents a complete absence of weight. Important note. While we often record continuous variables, such as weight, in whole numbers, for example, 70 kilograms, 50 kilograms, for simplicity, this does not mean the variable is discrete. By default, weight is a continuous variable because it can theoretically take on any value within a given range, including fractions and decimals. Our second question is age, which is recorded in categories as you can see in the screen. Answer. Data type: continuous. Level of measurement: ordinal. Explanation. Age is a continuous variable because it can take any value within a range, including fractions and decimals. However, in this context, we have divided age into categories, for example, 0 to 18, 19 to 35, 36 to 50, 51 plus, which are in a specific order or rank. Therefore, the level of measurement here is ordinal. Important note. By categorizing age, we have converted a continuous variable into an ordinal variable. The categories reflect a ranked order, but they do not provide the precise measure of age that continuous data would offer. Sleep Quality Scale Score. Answer. The Sleep Quality Scale is a psychometric scale built on ordinal items. While each item on the scale is ordinal, the total score of an individual, which sums the scores of all items, is sometimes considered an interval scale by some statisticians. In this context, I have taken the total score as an interval scale. Next question is pain on visual analog scale from 0 no pain to 10 worst pain. Pain on a visual analog scale is an ordinal variable. The numbers 0 to 10 represent ordered categories, making the measurement level ordinal. Some consider its level of measurement to be ratio data due to the presence of an absolute 0, indicating the absence of pain, and the assumption of equal distances between categories. Our last question is biological variables such as hemoglobin levels, red cell count. Answer. Variable, hemoglobin levels. Data type, continuous. Level of measurement, ratio. Explanation. Hemoglobin levels are continuous data because they can take any value within a range, including fractional values, for example, 12.3 grams per deciliter. They are measured on a ratio scale because they have a true 0 point, absence of hemoglobin, allowing for meaningful ratios and arithmetic operations. Variable, red blood cell count. Data type continuous. Level of measurement, ratio. Explanation. While the red blood cell count is seen as a discrete variable, however when measured per microliter, for example, 5.2 million red blood cells per microliter of blood, it is treated as a continuous variable. This is because the measurement can take any value within a range and is not restricted to distinct, separate values, and is measured on a ratio scale because it has a true 0 point, absence of red blood cells, allowing for meaningful ratios and arithmetic operations. That's all for today. I hope you liked today's video and find it informative. Please like, share, and subscribe to the channel for more valuable insights. Give your feedback, as it helps me improve my content.